Now, for the details and that ugly numbers when it comes to economics and also the rest of the virus-related news that you need to know, let's bring in our senior political correspondent, Andrew Whitman. And Andrew, they're brutal, the data.
It's unbelievable, these economic figures, Rich. Since the start of the outbreak, the U.S. economy has now lost as many jobs as there are people living in the state of Texas. Just under 4 million new jobless claims were filed last week, pushing the 6-week total to 30,300,000. And most experts think that is actually an undercount. And the prospects for a quick, beautiful turnaround, as the president might say, quickly being dashed. Even the president's top economic experts are now comparing the present moment to the Great Depression.
This is the biggest negative shock that our economy, I think, has ever seen. We're going to be looking at an unemployment rate that approaches rates that we saw during the Great Depression. During the Great Recession, remember that was the financial crisis around 2008, that we lost 8.7 million jobs in the whole thing. Right now, we're losing that many jobs about every 10 days.
Towards that end, some stunning new projections. The Congressional Budget Office, J.P. Morgan, and Morgan Stanley all now project that the economy will shrink by about 40% this quarter. Most project a rebound of about half that size in quarter 3, but there are a host of ifs in those later positive forecasts. That projected rebound depends on keeping the virus from plowing into a second wave as states reopen. But the White House now says it will allow its social distancing guidelines, those pamphlets that President Trump and Vice President Pence kept displaying at briefings, they will expire at midnight tonight. The president saying states are now taking the lead and have incorporated distancing in their reopening plans. But amid the rush to reopen, some headlines that many may see as setbacks. Starting Wednesday, the 24-hour New York City subway system will shut down during overnight hours so crews can disinfect every train and every station every day. And hundreds of armed open carry protesters stormed the Michigan State House today after it was another political protest masked as a stay-at-home protest. Speaking of masks, most in the group weren't wearing any. They also clearly violated distancing rules. On the political front, New Jersey Governor Phil Murphy meeting with President Trump today. And if you thought there might be fireworks or a confrontation, you were sorely disappointed.
We couldn't be making the progress we're making without you and your administration. And so to you and to your incredibly talented team with a very heavy dose of New Jersey blood on your team, including yourself, who knows the state extremely well, we thank you for everything.
Murphy wasn't just there to play to the president's ego. He also went to ask for state aid to help balance budgets ravaged by virus-related expenses. Trump, of course, opposes helping states. We've been covering this all week. States like New York, New Jersey, California give far more to Washington every year than they get back, while states like Florida and Kentucky, whose leadership opposes federal state aid, turn a profit off the government every year. So Murphy made his case with the cameras rolling.
The financial assistance we need, and we need a significant amount. This is a big hit, and this is somewhere in New Jersey alone could be $20 to $30 billion. But this is to allow us to keep firefighters, teachers, police, EMS on the payroll, serving the communities in their hour of need. And that's something that we feel strongly about. We don't see it as a bailout. We see this as a partnership, doing the right thing in what is the worst healthcare crisis in the history of our nation.
And you'll see those arguments ramped up in the coming days. All right, Andrew, thank you. I want to bring in our first guest, former Democratic governor and senator from Nebraska, Bob Kerrey. Senator, I always appreciate you giving us some time. Thank you.
You look better than I do.
Well, let me ask you a big picture. I got a bunch of specific questions, but a big picture question, because we all have this amnesia. We only think of the moment. But what should anybody, I don't care what state they're watching us in or what party they affiliate with, what should a person have a reasonable right to expect from their government and their president at a time of crisis?
Well, I'd say two things. The most important is honesty, describing exactly what's going on. And the second is a willingness to both admit mistakes, because you're going to make mistakes, and willingness to engage as many people as possible in trying to solve the problem, regardless of where they are in the political spectrum.
Well, picking up off of that, the one thing in terms of crisis that wrongly I think you usually take as a given is that, we're all in this thing together here. And as you said, we're all going to make mistakes. But this division, and I think it's probably best exhibited by this idea of a blue state bailout here, that we're picking states that got hit by a pandemic that no one here caused, that we're going to withhold funding for states in crisis, depending if they're red or they're blue, and unless they make almost some extortionary concessions. I really can't believe what McConnell is floating out there. Forget politically, I think it's crazy what he's doing, but just, it's unconscionable to me. What do you think about it?
Well, it's wrong. I mean, especially a state like Kentucky that oftentimes is asking other states to contribute to programs that are important to it. So, and it's particularly important in a crisis like this. It's disaster relief has always been allocated on a nonpartisan basis. Because they're different. The disasters come, and the nation pitches in and helps either the community or the state or the region deal with that disaster. That's what we did with Katrina. That's what we've done with every natural disaster since I've been following politics. It's always important for the leadership to begin and say, we don't care whether you have a state full of Democrats or Republicans. You've got a state full of people that are in trouble and they need help.
You're a veteran and a decorated one at that. Last night, I spoke with a reporter who broke the story of what's happening at VA facilities right now, both homes as well as also healthcare centers, and it is horrible. I mean, you see concentrations obviously in nursing homes, but not only is it applied to VA, but unlike some of the hospitals that don't have the necessary PPE, they've been muzzled because they can't go public about what they don't have, and it's broken so many of the compacts that vets have a right to expect. I don't know, it takes a lot to surprise me anymore, but I would figure if there was any constituency that would be looked out for the most right now, it would be our veterans, and it's in fact the opposite what's going on.
Well, especially in the Veterans Administration, 25% of all the patients go through the VA, and I'm one of them, although I don't have type 2 diabetes, but 25% of them have type 2 diabetes and other comorbidities that put them at risk. They're older, and they're more at risk. And it gets back to what I said at the beginning. I mean, you have to be honest from the beginning, and I don't think our president has been honest about the nature of the threat. And secondly, you have to be willing to admit mistakes because you're going to make them. So if you're in an environment where the president says anybody that criticizes me or identifies something has been done wrong, I'm going to get rid of them, it doesn't allow for the kind of, I think, open examination of what's going on and response when things are going wrong. And then the third is you got to share. It's got to be completely collaborative. I mean, imagine how different it would have been if the president had called the head of the National Government Association. It's a very important organization, 50 state members, and said to the states, you have a lot of authority under the Constitution, and we need to use that authority to develop, basically on the run, a plan, because we didn't have one in place. And you can go back and criticize all that as well, but from the beginning, this was described by the president as a hoax. This was described by the president as something not to worry about. More importantly, anybody who, if they express displeasure at one of these press conferences, their job is at risk. You just can't get through a crisis like this if that's your attitude, because it doesn't allow for the kind of self-criticism that's necessary to make things better.
Through this crisis, about 30 million people are going to lose the health coverage they had. And we had a political debate here, a few months ago that almost seems antiquated. Listen, I got reservations about the whole idea of Medicare for all, but there's more and more logic coming on board to having some universal health care that maybe was politically untenable a while ago, but people losing it right now during a pandemic might think differently. Do you think we ought to reapproach that given where we are right now and what we're going to be looking at for at least the next year or so?
Yes, I do. I think if you look closely at what's going on, I don't know if I look as close as lots of people are doing, but if you look closely at what's going on, you're clearly seeing that this disease has a greater and negative impact on people that don't have either health insurance or immediate access to high quality health care. So you're going to see inequality of the allocation of suffering as a consequence of simply not having a system that protects everybody. The Affordable Health Care Act attempted to do it, but even it left gaps in it. It's a sort of moment when you could actually start thinking about, rather than Medicare for all, perhaps Medicaid for all. Let the feds take over all of Medicaid. Let the states do what they're best at, and it would have a tremendous positive impact on state budgets as well. But we have to do something other than status quo, because I think you're going to see unacceptable allocation of suffering as a consequence of people not having health insurance or people not having access to being able to get to see a doctor and get tested.
Not long ago, we saw the primary in Wisconsin play out, and we now know there's more than 50 cases at least, and the number expected to grow about people who contracted the virus because they were trying to exercise their right to vote, and the idiots didn't let them vote by mail. Fauci's telling us this thing could come back in the fall or winter. It's very conceivable in November. People will be putting themselves at risk here to vote. It doesn't take Kreskin to foresee this is going to be a problem. My point is, I guess, what's it going to take for Washington to say, my God, let's avert the train wreck here. Let's make sure you can vote by mail if you want to now.
Yeah, you dated yourself citing Kreskin. A lot of younger viewers are going to vote, who the hell is Kreskin? So anyway, yeah, you're 100% right. I mean, it's not just Fauci. I mean, every pandemic of this kind caused by a virus has come back. So we don't have natural immunity to this, and the herd immunity is going to, even when it develops, it's probably a year from now. Yeah, there's going to be a second wave and maybe a third. And we're going to have to learn to live with it. We're not going to eliminate this particular virus. There's a lot of things we're going to have to do to adjust, and among the things we have to do is adjust our election. It's easy to see the answer. You got to have every single American casting their vote by mail. It's simple.
Yeah.
And it might be more difficult with the president wanting to not fund the Postal Service unless they raise the price in order to be able to get at Jeff Bezos. But if you use the Postal Service in this way and you fund them properly, every single American can vote much more easily, and your participation rates are going to go up. That's what we saw in Wisconsin. Rather than having fewer people vote, we had more people vote. Why would we want to make it harder for people to vote when, as you say, among the risk that you're going to face if you go vote in November, there's a possibility you're going to contract COVID-19 and die.
Yeah. And I always, by the way, went with Karnak just to show how way too old I am here. But Senator, I appreciate it. Hang in there. By the way, I love the background, a rainbow when we can use it. Yeah.
Did you hear the story on that?
No, tell me.
Every night at 7:00, New Yorkers open their windows, and if they have balconies, go out and applaud the healthcare workers. 2 weeks ago, last Monday, at 7:00, when they all do that, a storm broke over the city, and that rainbow appeared over the city. That's a real rainbow, and it happened while New Yorkers were thanking the healthcare workers.
I could just tell you as a sidebar, my wife works in a hospital in New York, obviously, and at 7:00, it is deeply appreciated by all those folks on the front lines and behind the scenes as well. But Senator, I thank you, and as I said, we'll get through this, but it will be an interesting next few months.
Tell your viewers who Kreskin is after I go off air.
Deal. Okay, Kreskin, for the younger folks out there, he was made famous on Carson. He was a mentalist. He could tell your future. He could predict things. A little bit of magic and shtick worked in there. Check it out on YouTube. You won't be disappointed. By the way, still kicking, I think in his 80s. All right. Just like everything else in America, coronavirus has totally upended our legal system, and it's also leading to a huge amount of litigation and class action lawsuits. Our panel of attorneys, the guys will join us after the break. Take a look at all of that and more.